C-Sorb Silicone Border is a high-performance superabsorbent wound dressing with a gentle silicone border and an adhesive-free contact pad designed to absorb and retain moderate to high levels of exudate while providing secure adhesion. Before the dressing change, gather all the equipment required for the procedure. Step 1. Open the procedure pack and drop it onto the work surface. Unfold the sterile field by the corners. Open the C-Sorb Silicone Border dressing pouch and drop the dressing onto the sterile field. Use the disposal bag included to safely arrange your pack contents. Step 2. Use the disposal bag provided in the procedure pack to remove the patient's existing dressing. Gently lift the dressing from one corner and work your way around the edges. Once the border has come away from the skin, carefully peel back the dressing from the wound bed. Invert the bag with the used dressing inside and place it close to you for any additional waste. Step 3. Once the previous dressing has been removed, cleanse the wound in accordance with local trust policy. After, gently pat the surrounding skin dry. Step 4. Peel back both sides of the protective film backing to the edges, creating side flaps to help with the placement of the dressing. Place the dressing over the wound, ensuring the wound bed is central to the absorbent pad, and carefully remove the backing film as you smooth over the border until the dressing is secure in place. C-Sorb Silicone Border is suitable for use under compression hosiery and wraps, and can stay in place for up to 7 days, depending on the exudate level and condition of the wound. C-Sorb Silicone Border, comfort for patients, confidence for clinicians.